Hello, my name is Georgette and I'm a diabetes specialist dietitian from the West Hampshire Community Diabetes Service. In these short videos, I'm going to cover how to improve your carbohydrate awareness and give you an introduction to carbohydrate counting. So what is carbohydrate counting? It is an important part of diabetes management, especially for people with type 1 diabetes. More recently, it's being incorporated into the education and management of type 2 diabetes for those who are also on an insulin regime called a basal bolus regime. Foods containing carbohydrate will have the greatest effect on blood glucose levels after eating. They include all starchy and sugary foods. If you think you need a recap on which foods contain carbohydrates, then please go and watch our previous video to improve your carbohydrate awareness. If you live with type 1 diabetes, you need to inject the right amount of fast-acting insulin, also referred to as your bolus insulin, for the carbohydrate in the meal you are eating. Essentially, you have to learn to think for your pancreas. Carbohydrate counting is a system of assessing the amount of carbohydrate in each meal or snack and then injecting the insulin to match the amount you have eaten. This approach requires you to take some more time to learn about the foods you eat, where carbohydrate comes from, and how much carbohydrate there is in different foods. Obviously, it's important to have a healthy diet, but carbohydrate counting gives you more choice and flexibility in both the type of food that you eat and also in your meal timings. So another benefit is that by being more accurate with your carb counting, you can also help maintain your blood glucose levels closer to your target levels. Whereas when you guess or estimate your carbohydrates, this can lead to discrepancies and more variability in your blood glucose levels. So essentially, the amount of fast-acting insulin or bolus insulin you need varies depending on how much carbohydrate you eat. And each of you will have a different insulin to carbohydrate ratio, which may also vary at different times of the day. We will cover more about carbohydrate counting and insulin dose adjustment, including correction doses, separately. So if you're not sure which one your fast-acting insulin is, it might be known as Nova Rapid, Humalog, Fiasp or Apidra. Just a few things to remember. Your fast-acting insulin generally peaks between 30 to 90 minutes and can last up to 4 hours. And its main purpose is to try and manage the rise in blood sugar after eating carbohydrates. So meals with little or no carbohydrate, for example an omelette or a salad, will not normally require any fast-acting insulin to be given. And snacks, so you shouldn't need to eat snacks routinely unless you choose to. And if your snacks are less than a 10-gram amount of carbohydrate, most people will find that they don't need to give any of their fast-acting insulin at all. And we wouldn't recommend giving insulin with a snack if you're treating a hypo or if you're compensating for some exercise that you've done.